Again, with Dr. Trehan, I want to time travel a bit with you. So, going in the past. So, after a successful career in the United States, you came back here. You wanted to start innovative healthcare, which is what we have seen from you. So, you returned to India to revolutionize, especially cardiac care. So, what inspired this decision, and how, as a journey, shaped your vision for Indian healthcare?
So you know why I went to the United States at a time when cardiac surgery was just actually taking off. It was in the very preliminary stages. And I went there in 1969, and that's just the time when coronary artery bypass surgery was invented. Because millions of people were dying around the world, including India, where people would get blockages in the arteries of the heart, and then there was no treatment for it. So I was fortunate enough to be trained by one of the inventors, that is Dr. Frank Spencer at New York University, who actually invented the internal mammary artery bypass graft, which has become the gold standard today. Okay. So that, in other words, I got into the ground floor of the development of heart surgery. So what happened was that after I finished my training, Dr. Spencer and the university asked me to join the faculty and do some teaching and practice and all that. So that's what I was doing. But when I started the private practice, large number of patients from India would come to New York for me to do their bypass surgery because it was not available in India at that time. So then what happened was that there is everyone who came had the same thing. Says, why do we have to come here, spend $50,000, uproot our whole family, take a risk on a plane? So in the back of my mind, I always wanted to come back to India. So it just was that impetus to say, yes, it is needed badly. But what I did not want to do was to just come and practice over here. I did believe that we should get the full ecosystem of cardiac treatments in a place where it was equivalent to, say, Cleveland Clinic or Mayo Clinic. The heart institutes were always part of a bigger hospital, but unfortunately in Delhi, those hospitals never existed. So that is why we took the longer route, and many events happened. Mr. Hari Nanda, who was the chairman of Escorts at that time, and I teamed up to create Escorts Heart Institute. The idea was that we would have the best of clinical cardiology, best of interventional cardiology like stenting and all that, and best of heart surgery. And not only that, that we would be able to train a lot of people. So that's how the concept of Escorts Heart Institute was created and opened in 1988, where many, many good people joined in, and we created one of the finest heart institutes in the world. We grew it, doubled it over the next 10, 15 years, and I ran it for 20 years. So it became clear to me at about 2003, 2004, that it was very good that we did that cardiac institute, but at the same time, it had limitations in the sense we were the best heart surgery, best angioplasty, best of everything of that kind. But when it required other specialties, they were not of the equal standard. So that's why I felt that, thinking about it, that this kind of concept is represented by institutions like Mayo and Cleveland Clinic and Harvard and Johns Hopkins. So those are some of the examples that always were alive in my mind. And we said, it's time to create the next step. And that was Medanta is more like a Mayo or a Cleveland Clinic of the East, where the platform is so large enough that super specialists of all specialties work together on the same platform. So in other words, the patient gets the best of every specialty, because you don't have one disease, you can have many things associated with it. So that is the reason why Medanta was established, and we opened in 2000, end of 2009, beginning of 2010. So that's the journey from when I came back. And the whole thing of Why creating Heart Institute? Why creating Medanta?
You have witnessed an exceptional growth in recent times. Like every quarter, there's a significant improvement in profitability and operational efficiency. So, what have been the key drivers behind the success, and how do you plan to sustain this momentum in the coming years?
So I think there are three elements.
Okay.
And you can say the first one is quality of care, quality of care, quality of care. So that is, to us, the patient is the center point. We must give the patient the best possible treatment available anywhere in the world, collectively, not only singly. Okay. The second thing is that they should feel the comfort and the compassion of medicine, of the doctors, of the nurses, so that they feel like because half the participation is the patient's and his psychology.
Mm-hmm.
So that would be, and then to make it as affordable as possible. That's been our three main drivers. And that's one of the things that when you say successful or doubled or anything, those are meaningless things. The main thing is that the patients should be treated well. They should be cured properly with the best possible treatment. And also they should not crumble under the financial burden.
So going on, if you can just slightly touch upon the expansion plans, the strategies which you are bringing in, or you were talking about tier 2, tier 3 cities, how important it is in the rural healthcare belt. So what is the plan for Medanta?
So ultimate goal of medicine anywhere should be to provide the highest quality of care at affordable costs to all your citizens. So our participation is in that endeavor to provide that healthcare to all the citizens. And progressively, what is happening is that if you notice our movement forward is in areas where people are underserved. So if we want to take the best quality of care to them at affordable costs, in locations where they are underserved. So you look at what we did here. First we were in Gurgaon. Then the next choice was Lucknow. We made a 1,000-bed hospital there because there were some government institutions, but there were not the public at large. It's a big state. The public at large is for 20 crore people. You need a lot of capacity.
Yes.
So that's what we did. We built a 1,000-bed hospital. And then Bihar was the next state where it was underserved. So we did Patna. On the side, we did Ranchi and Indore. So the Madhya Pradesh and Jharkhand were also underserved. And that's what we are doing, basically providing services where they are needed. And that has been a very good journey for us.
The US has imposed high tariffs on medical equipment. It's 26%. So how do you see this impact on the private hospitals like Medanta? Will higher cost of advanced medical technology will have an impact on the patient affordability and operational efficiency?
No, that doesn't make too much of a challenge for us because of the fact that it's reverse tariff.
Okay.
We don't export much of medtech to US or countries like that. Yes, the pharmaceutical industry will get affected because I'm not familiar with what the tariffs were before, but what he has done is this reciprocal tariff. India is leaving 50% on something. He wants to do 25% at least, so half of it. Okay. So in a way, I guess this is the new order of the world. We'll have to learn to live with it and be competitive. See, one thing good about India is that we do have the demographic advantage. I believe we have superior brains than anybody in the world. This is my belief.
Yeah.
And if we put our intelligence along with collaborative work, along with incessant search for new ideas, technologies, new frontiers, I think India can actually survive it under any circumstances and it'll actually become a leader. So I think we just need to pull up our bootstraps and get ready for the world to be much, much more competitive. And I think That's important.
Okay. So recently Medanta has been recognized in Newsweek's World Best Hospital, so ranking for the sixth consecutive year, so making it the only Indian private hospital on the global list. So there is this recognition. How do you see it?
So see, Newsweek conducts an annual survey in 28 countries of all their hospitals. So fortunately, Medanta has been named as, for 6 years in a row, as the best private hospital in India. Okay. But not only that, they also do a world ranking, and we are ranked in the first 150 hospitals of the world. So these are very nice recognitions to get from an international agency which does 28 countries. So good. But the basic thing is that one needs to continue to strive for the higher standards on a daily basis. So the two principles that I live with, and as I've said it many times, is that if you are standing still, you're actually going backwards. And if you are not better today than yesterday, then you wasted 24 hours. So that's the dictum with which we live.
Yes.
And that's what I try to inculcate in everybody in our institution. So basically, there is a kind of strive for quality, as I told you, and it's continuous. Because our work is like a 24-hour work, and the technological improvements and the increasing innovation that is happening in our field is just electric. So we need to keep up with all that and provide that relief to our patients.
Medanta is also known for its world-class facilities, like 5-star healthcare facilities. But how do you ensure the high-quality care remains affordable? Like, how do you balance it for a wider population and also maintaining the financial sustainability?
See, if you notice, we have adopted the model that where we serve a very large number of people. If you look at our facilities, 1,400 beds, 1,000 beds, 700 beds, that's exactly the model that we have followed. So what we are doing is basically making smaller margins on a large population that we serve, is that we have a large volume, low margin, so that you actually end up justifying the investments that have been made to create facilities like this, which is very expensive. But at the same time, the individual burden becomes less.
Okay.
That's what our endeavor is. So that's why we keep it affordable we are third, fourth, as if you look at the more expensive places, we're third, fourth in that ranking. And we are, as you know, the best quality. So that's the balancing act we do all the time.
Okay. So there is also often a perception that private healthcare is expensive and lacks adequate regulation. So in your view, what steps can government take to enhance the trust of fair pricing? And also with next generation therapies like high cost treatments, we have a injection which costs 60 to 70,000. It's called Lecuvia. So how can we strike a balance between making cutting edge treatments more accessible to patients, certain drugs and injections especially?
So you're right that what is happening is innovation is happening mostly overseas. And if you look at, say, a new drug that comes out, or like you just mentioned, a new injection for cancer or whatever, what it is that they have a certain cost for doing the research and development and whatever they do. And they claim that it's a very highly costly endeavor. And also the fact is that many of them just get knocked out by the side. They don't become effective, so they're not marketable. So once these foreign companies, a large pharma as we call it, has a new innovation which works and which is approved by FDA, then their input costs have been so much that they want to recover it. And they recover it by pricing it very high. Now, it so happens that in India it becomes even higher because every dollar is worth 80 rupees, 90 rupees now, right? So there is a mismatch there between new technology, latest treatments available, and affordability. Now, the only way to bring it into balance is that if we become the center for innovation, like what happened to China 20 years ago, 25 years ago, they actually decided we are going to be the center. So they systematically worked their way into becoming a world-class innovator. Similarly, India has the opportunity, because if you look at it, we have been very strong in AI and generic drugs. Generic drugs are copycat drugs, but not enough resources were spent in past years. It's beginning to happen now that new molecules were not developed in India. They were just waiting for patent to wear off, and then we'll manufacture it. So that model has to change. Secondly, we are the hub for IT. I think 70% of all the world's innovation in IT and all that comes out of India in one form or the other. Then we are not the one who have supported that innovation with enough investment to transform it into products. So India needs to get onto the wagon, and I think that's what the government's plans are. That's all the schemes about Made in India and all the PLIs and all that. This is all encouragement. So I think India's headed for a very successful participation in the platform for innovation in the world.
So, talking about the operation and maintenance model becoming a preferred strategy for hospital expansion in India, what do you think this trend is driving into? And if you can talk about O&M model for hospital expansion, particularly in regions where you already have a presence. So, what factors influence your choice of cities for this model?
I think, like I said earlier, we like to go to underserved places.
Yeah.
And because you know that people need it, and that is your moral duty to be able to, if you're going to be a participant in the healthcare provider space, then you should do things like this, which will only help to get healthcare to different parts of the country. The government is doing a lot also. So what can be done to leverage this better is that the coordination between the government and the private providers should be much more closer than it is today. Because of the fact, and it proved itself in COVID times, when we all worked together, India came out ahead of most countries. So now we have a challenge that the trust deficit that exists should be bridged very quickly, because we are in the same space to provide succor. Now, when you say that private healthcare is expensive, you should also look at the input cost. Everything has an input cost. And the government also calculates on its own, and that also is quite expensive, giving high-end treatment to patients, because the input costs are high. So this is a challenge, that how do you balance the need? But India has taken, or the government has taken, some very bold steps about Ayushman Bharat. And also the Prime Minister has championed that cause. So as we move forward, more people, anybody over 70 has been included in it. So these are things that the government is doing, along with other schemes, that will bring all the people who were left out of the health security to be able to come into the health security. And I think we as private providers must actually participate with them.
But of late, certain hospitals are not wanting to be associated with PMJ. And few Indian Medical Association, Haryana had an issue of late, and a lot of others have raised questions due to delayed reimbursements. So how do we walk the talk?
See, what can the private sector do? It's an individual choice.
Okay.
Because then everybody has to see what works for them or doesn't. We certainly have participated. But it is true that delayed payments cause a huge burden. And that huge burden, because then it's like money that for operations, a lot of people have to borrow. Delayed payments to the vendors. So all that stuff, that mismatch does pose a big challenge to people. So I think the government can help by processing the bills more efficiently or rapidly, so that the burden on because ultimately no matter what burden comes on healthcare, it is passed on to the patient. Like everything else, it's like the patient.
It trickles down to the patients.
It trickles down. So that's why I think this is a collective effort we all must make to reduce cost on a daily basis. We should cut out waste. We should find good substitutes or safe substitutes for imported stuff. We should encourage the local industry to establish and collaborate with them to develop newer and newer devices and therapies. So I think this is a ecosystem which is coming into play by, I think the government has done a great job of encouraging this, that innovation must happen, we must manufacture, we must do all these things. And that has also given impetus to our professionals who are very busy doing their work on a day, all day, to actually participate with industry, which has always been a partnership in the world, which has helped everybody to create new things. So I think it's happening.
So number of medical colleges has nearly doubled a decade, growing from 387 in 2014 to 706 in 2024. And also the nursing colleges have also increased from 5,700 in 2014 to 8,692 in 2024. So how can we ensure the quality of training matches this expansion in quantity? Because we have the dearth of nurses here and even the medical colleges.
So there is a definite mismatch.
Yes.
Between the demand for healthcare professionals and our production lines, which is true, but the gap is being narrowed because more and more medical colleges have contributed to doctors coming out. What's important is that yes, the number of medical schools have increased, number of nursing schools have increased, technical colleges have also improved. The basic thing is this is an effort to fill the gap. There's a big gap between demand and supply. But in our effort to close the gap, quality must be maintained. Why? Because each one person, whether it's a doctor or a nurse or a technician, they are actually taking care of patients. And anything that goes amiss actually affects adversely to the patient. So that we should not allow and that we must work. So that's why we have a very intense training program in Medanta, where people are inducted, but they are also go through a rigorous training program so that the quality of care becomes consistent and that you can actually make people aware of how important our job is, because it's zero tolerance. Anything we do is zero tolerance because it's going to be very consequential for the patient. So that's why I think that's an important factor, that we add good training facilities even after you've done your theoretical course.
Okay. So talking about the number of private hospitals, which has surged 27% since 2019. So how has this impacted the accessibility and affordability side of healthcare in India? And private hospitals are said to add over 22,000 beds in the next 3 to 5 years. That is like triple the number added between financial year 2019 to 2024. So what factors are driving these accelerated expansion?
I think one, because people are seeing that there is a demand for healthcare facilities. There is also, if you look at it, that a lot of people have been brought into the healthcare security loop by the different schemes of the government. So there is definitely a feeling of buoyancy in the sector. So that's why. But people should be careful about wanting to. It's not something to make money. You see, one dictum that I've said always is that a good medicine will give you good returns, but good business will not make good medicine. So that's why it should not be your overriding interest to make money or do a business. It should be to provide the highest quality, and money will come on its own. That's my thinking, that this is what I like to say to everybody, that don't get into it because you think it's making a lot of money, so let me also get into the field. It's not a good preamble to doing something.
So now you have worn multiple hats throughout your career. You have achieved so much remarkable milestones. Like, it's been a fabulous journey. I mean, for us, when we see from outside. So how do you feel? You feel a sense of completeness, and what new aspirations is driving you forward? Maybe like in 5 years down the line, what do you want to see? Like, if you can give a Medanta perspective also, and overall in healthcare perspective for India.
See, I'll go back to what I said, that if you look at medicine, science moves with the speed of lightning.
Yes.
Right? So you need to be, if you want to be relevant, you need to actually grow with it. Okay. Second is, what is your end goal? Your end goal is ultimately to provide that healthcare that every individual understanding on the earth of India is entitled to. That is your end goal. Now, we all have to collectively work towards that goal, and that goal has many pillars. I mean, the physical structure is only one. Then we talk about the technology, we talk about the human capital, but human capital has many tiers. So the last person who participates in this effort to provide that healthcare is a vital function. So I think that there is I'd like to see is that mission accomplished, because as our Prime Minister said many times, India is going to be, by 2030, one of the first 3 economies in the world. But we also have to produce that quality for everybody, right? So that's what I'm trying to say is we need to, it's an endeavor which goes on and on and on, and we need to do it incessantly.
Thanks a lot, Dr. Trehan, for that time. Thank you so much.
Okay, thank you.